What do we do to treat heel pain in the podiatry clinic? Hi guys, it's Kent here and I'm the podiatrist from Active Care Podiatry, and heel pain is one of the really common things that we see in patients in the podiatry clinic. So there's a few things that we do, and some of these are very, very basic and you probably already know these, and some of these things are might not make a lot of sense, but I'll explain why we do them. So the very first thing is we don't aggravate your foot anymore. If you know walking's hurting it, we need to stop your walking. Not permanently, just temporarily until we can be pain-free. The second thing, we use ice to ice your foot, so it just helps to moderate the inflammation, and if we can moderate the inflammation, it means it's going to heal just a little bit more quickly. It also helps with a little bit of pain relief. So the next thing we get you doing is we look at your feet and assess your feet and see if do they roll in too far, do they roll out too far, do you have tight calf muscles? Is it actually heel pain that you've got, or do you have a bruised heel, do you have plantarfasciitis, or do you have plantarfasciitis? There's certain little nuances there that it'll mean we treat them slightly different. So largely what we find is in a foot that's got heel pain, it'll roll in too far, and you'll have a tight calf muscle. So usually what we do is get you stretching out your calves. We might release your calves. We get you wearing a good shoe to support your foot. We make an orthotic insole like this one to support your feet and help them to stop rolling in. And the reason why supporting your foot and stopping it from rolling in is such an important thing is because when our foot, this is the inside of a left foot, if our arch collapses, the ligament that runs the length of the arch, if you imagine that's where this pen is, gets stretched, and where it attaches right in the heel starts to pull away a little bit, and you get like a bruised sort of feeling. So when we've got plantar fasciitis or heel pain, it can be anywhere from the heel all the way down through the arch. So if we can stop that arch from collapsing in, or limit how much it collapses in, or even how quickly it collapses in, it just rests that plantar fascia and rests that arch, so you won't have as much irritation across your walking day. Calf stretching, good shoes, icing, resting are really the basic things we start with. We can also use some physiotherapy and dry needling and this sort of stuff that we sort of add on to the treatment. And we've also got some little exercises and things that we can do to help to get elasticity and strength back in your foot, so your foot's more equipped to deal with your day-to-day activities. So that's how we get started on a heel pain treatment in the podiatry clinic. It's a really, really common problem, and generally what we find, the sooner you get it treated, the better the results. If you've left it for a year, it takes a lot longer to actually get any traction with your treatment. So if you have any questions, please comment, but if you need any further help with your heel pain, we're of course more than happy to help out at the Podiatry Clinic, and we're at Capalaba and Victoriapoint. And if you have any questions, please comment below.